Hello, everyone. Thank you so much for joining our webinar today on All About Access through Luma Health. We are really excited to talk a little bit about sort of how we define access to care and patient access and why we're so committed to it. And also to kind of talk about some of the steps that we've taken with some of our clinic and system partners in order to help improve their access numbers and help them to grow sustainably to meet patient demand. So I'm Alex Harris. I am the product marketing manager at Luma Health, and I'm really excited to talk with you guys today. Access to care is something really near and dear to my heart. I feel very strongly about it. I've worked in community health for about 7 years. Previous to my time at Luma Health. And so, part of what drew me to Luma Health was the fact that we were founded on the idea that healthcare should just work better for all patients, no matter who that patient is and where they come from. It should work better, and access to care should be easier. And so we at Luma Health really focus on this by developing technology that can empower providers to increase access to care and streamline patient communications, all while helping to grow their clinics and their systems to be able to grow and meet increased demand. So a few things here that we are going to talk about a little bit today include how we define access, like I said, at Luma Health, and what we're talking about when we say access to care and what that really means for both patients and then for providers at clinics and systems. We are also going to be talking about how to implement a successful outreach strategy, sort of what our partners have accomplished through taking sort of a trifecta approach to outreach. We're talking about building an always open digital front door and how you can do that without super complicated systems and clunky electronic interfaces. We always are trying to keep it simple for both the patient and then for staff. We have 8 ways that you can be thinking about to stay connected with patients throughout their care journey. And then we'll be talking about how to scale your business to meet demand. So some quick tips that we found to be helpful and that we help with here at Luma Health to try to figure out how you can kind of optimize your capacity to increase access. So a few things that I think we all kind of intuitively know, but I think is really important to point out is that access to care is hugely impactful for patients and then for, the entire society that we live in. So we know that access is really linked to quality outcomes. For example, whether access means, the geographic area that you live in, the number of providers in your area, maybe it's coverage rates of your patient population. We know that it has impact on things like asthma outcomes, blood sugar control, chronic disease management, preventive care rates, ER use, and so much more. And so many studies have shown that like this quote says here in the slide, that access and quality are really, really intertwined. And so certainly quality indicators are not always access indicators, but we know if we start with a strong foundation and a strong focus on access to care that we can move the needle on quality outcomes. We also know that access to care lowers healthcare cost over time. Again, studies have shown that clinics and systems are able to scale and meet their demand without really raising their overall costs. And of course, when patients get access to the preventive care and the chronic disease management that they need, it prevents those costly ER rooms and other sort of expenses incurred over time. And then, of course, we all know in healthcare that health and wealth go hand in hand. So if you're not healthy, you can't work. You're not economically mobile. And so it's so important, we think, to really focus on that foundation of access to care to help our communities really prosper. So what does access mean to us? For us, the patient is at the center of everything that we do. We try to design our technology around what really works for the patient. But as equally as important is, does that work for clinics and systems? Because you guys are the ones on the ground, obviously delivering the care that patients need. And so any access solution has to be something that's going to work for your practice and your business. And so for clinics and systems, we really see that meeting patient demand for services is critical. If you have an influx of patients and maybe you are, kind of at the ceiling of your capacity, how can you increase that capacity to see more patients? Streamlining the patient's experience and getting to care to make sure that the patients have a good experience accessing care in your facility, so that it's easy, it's not complicated, they don't have to wait forever, and they get the care that they need when they need it. We also think it means succeeding under managed care and pay for performance contracts. So we know that a lot of value-based contracts have quality indicators in there that are really more related to access. Do patients have access to preventive screenings, for example? Are they coming in for regular chats with their doctor so that they can have the tools that they need to manage their chronic conditions? And we know that's incredibly important. And then obviously we like to talk about increasing revenue and really growing your market share as a business so that you are increasing access and helping your business to thrive at the same time. For patients, it's really access is the first step to overcoming illness and to getting on the path to healthy. If they have symptoms or a condition that's out of whack or really impacting their functionality in their life, they need to go see you and they need to figure out what steps that they need to take and what treatment they need to get to where they want to be. We also think it's really about reconnecting with providers throughout the care journey. So we really feel strongly about taking this kind of holistic approach to the patient journey. It's not just that first point of access, but it's all the points of access in between when the patient first, falls ill or notices that they need to achieve a health goal, and then when they actually achieve that health goal. And then also is how they get the attention, the medication, and everything that they need to get and stay healthy. And so that's kind of the approach that we take when we talk about access. So kind of super simplifying it here for us, we think access to care is really about the right care at the right time and the right place. And so we are really committed to working with providers and you all in this webinar to kind of figure out how we can make that work for your unique practice or system. So how to boost access to care. So this is kind of where we'll go in a little bit more and dig into how we've worked with our partners, our clinics and systems to develop strategies to leverage technology and make it easier for patients to access and easier for practices and systems to manage patient growth. So for us, it all starts with outreach. That's kind of number one. And so we sort of feel like it's a trifecta approach to a good outreach strategy. The first is elevating your online presence. And this, can be a super broad category. That's everything from, can people find you online? Is your website functional, et cetera. We also think it's all about online reviews. We know that people are starting to trust online reviews as much as they trust a friend's recommendation, which is kind of huge if you think about how you make purchasing decisions these days. And in healthcare in particular, more and more patients are actually shopping for providers and doing so online. So going to Yelp, going to Google, going to HealthGrades, and checking out those reviews to figure out which provider they want to select to provide them care. We also feel like outreach to referred and attributed patients is critical to any outreach strategy. So if you're a specialty practice and you're getting a lot of referrals, it's important to have a system in place so that you're reaching and connecting with all of those patients. They want to hear from you and you need them to hear from you to make sure that they come in to your practice or clinic for care. And then similarly, if you are a primary care practice or you're otherwise getting a list of attributed patients, maybe from a Medicaid managed care plan or via Medicare ACO, making sure that you have touch points with all of those patients, inviting them to see you for care, both to help you drive business and also to help make the process easier for patients so that they know where to go for care. And then finally, reconnecting with your existing patients. Again, like we said, we don't think access is just that first touch point, it's all of those touch points in between. And so making sure patients who you maybe haven't seen for over a year or over 18 months can come back to you for any preventive care services that they need, any follow-up services or appointments that they need, et cetera. Automating and streamlining that process so that you're always reconnecting and re-engaging existing patients is critical, both to help build that patient loyalty and that relationship, and also to help patients achieve their health outcomes. So a few results from some of our partners. So one of our features is the ability to drive happy patients to leave online reviews. And so an OBGYN practice that we work with in Florida was able to, in just a few months, drive 200 new online reviews and building their Google rating to 4.4 out of 5, which is huge and awesome and really helps elevate their online presence. So people can, who are seeking an OBGYN or seeking care in that area, can easily find them. And then another partner of ours, Alexander Valley Health Center, was able to implement a process with Luma Health to automate outreach to attributed patients from their Medicaid managed care plan. And so through that process, they actually increased new patient conversion by 3.8 times. So their rate of conversion, which was much higher than other primary care providers in their network, because of their commitment and their ability to streamline outreach to those patients. And so, you know, outreach is critical, but then you also need a way for patients to be able to make an appointment with some level of ease and convenience, which we know is a lot easier said than done, which is why we are super committed to helping our partners and our practices figure this process out a little bit. So building a better digital front door for us really is all about online scheduling that is easy, and also the ability to call, text, or go through multiple avenues to schedule an appointment that they need. And so we know a lot of healthcare associations like MGMA and the American Academy of Family Physicians recommend that practices implement technology to make scheduling easier, both for the convenience of the patient, but also to save some valuable staff time in scheduling. So for us, what that looks like is 24/7 convenience for the patient, being able to select the right appointment slot with the right provider, and being able to reschedule if necessary, if something comes up, which as we all know as patients, it almost always does, having the flexibility to find another alternative time is really important. And so for us, again, that digital front door really means that your patients can call, text, or go online to get the information that they need for an appointment. So one of our partners in Montana actually implemented online scheduling through Luma Health, and they started really quickly booking a third of all of their appointments online, so saving really an incredible amount of staff time booking appointments, and really showing that patients kind of were looking for a simple solution like that. And actually, of those appointments booked online, half of them were new patient appointments. So by offering that service, not only were they increasing the convenience for their current patients, but they were also helping to attract new patients um, to their clinic and making it easy. For most of us who are working all day, sometimes stepping aside and finding time to call and figure out a time to make an appointment with a healthcare provider, it can be really tricky and difficult. And so being able to just go online at any time and find the right time with your provider of choice is huge. And so we were really excited to see some of these results from one of our partners, and look forward to seeing some more stuff coming down the line. So we also know that staying connected with patients throughout the entire care journey is critical. A 15 or 20-minute visit with your provider to talk about your symptoms, your concerns, your health issues, is important, but certainly the journey to getting healthy lasts a lot longer than just that short appointment. And so, obviously bringing patients in for follow-up care is critical, but also there are other touch points that providers and patients can have between those visits that don't place a huge burden on the provider of time. Since we know not all of these are necessarily reimbursable, but can be really streamlined and automated to help the patient achieve those health goals without putting too much of a time stamp on providers. So one of those is providing health education content to newly diagnosed patients. So one of the things that we are trying to do a little bit more work around is figuring out how we can automate messages, either, for example, to newly diagnosed diabetic patients, perhaps to patients with a new diagnosis of hypertension, some common conditions that require some chronic disease self-management. Can we automate some really valuable and really rich health education content to those patients so that they have a little bit of information at their fingertips in between visits? And then when they go in for that follow-up visit with their provider, they're more informed and they might have better questions and more unique and specific concerns to address. We also know that text message is actually a really important tool to offer health literacy support to patients. Studies have found that when addressing issues of health literacy, it's important, as you guys probably know anecdotally, just to break down that information into smaller chunks, to give patients time to ask questions and to think about that information and to process it. And text message is a really great way to do that because you're forced to kind of break down information into smaller chunks. And two-way text messaging means patients can respond and ask questions about that information, which is a great way to get patients comfortable with their diagnosis and what they need to do to get and stay healthy. Answering patient questions, again, kind of helps support that health literacy, and any sort of two-way messaging and two-way secure chat will help patients and providers have the space that they need to address those questions, which is critical because as providers, as you guys are starting to focus even more on quality metrics and scoring and reporting on those quality metrics, being able to have that additional touch point to address a patient concern can help get that patient on the path to succeeding in their quality goals. Checking in on symptoms between visits, we also think is important. So, maybe the patient doesn't necessarily have a question, but the provider wants to check in and see if things are improving. And so, secure chat, two-way text messaging is a really great way to be able to reconnect with patients in between. Finally, following up with patients post-discharge. So if you are getting a list from your hospital of your patients who have recently been admitted and discharged from the hospital, it's a great idea to start thinking about automating some outreach there to those patients to see how they're feeling and give them a chance to either make an appointment with you or ask a question via secure chat. And that can help prevent those readmissions and also make sure that patients feel comfortable about their discharge instructions and their ability to recover from their hospital stay. We also know that collecting patient-reported outcome measures, which is kind of like a new, not necessarily trends, but seems to be becoming more popular. Technology can really support this because it can give patients a way to kind of securely send information to their provider based on a particular metric or a particular measure that the provider wants to collect. And so that can help providers really think a little bit differently about these quality outcomes and to help patients have a way to sort of express their symptoms in sort of a more quantitative, more tangible way. And of course, in between visits, so it's not always tied to an in-person visit. Of course, telehealth and virtual visits is another way to stay connected. So maybe something patient concern doesn't necessarily require a complete trip to your clinic or system. Maybe it could be done via either secure chat or via a video visit. I think there are multiple ways to go about implementing something like this, and certainly a lot of considerations about who this could be offered to and how. But definitely an important way to consider staying connected with patients in between office visits. Oops. And then finally, reminding patients about preventive care, we think is huge and sort of baseline for increasing and improving access to care. And so something we've been able to work with a few of our partners on is figuring out through data in the EHR which patients are due for certain preventive care procedures, whether it's a mammogram, a pap smear, colonoscopy, diabetic eye exam, et cetera, and automating outreach to those patients to invite them to come back in for their follow-up care or their next preventive care procedure. So again, a few of our partners have kind of taken this approach of looking at different ways that they can keep engaged with their patients in between traditional office visits to both make those visits richer and to help patients have that access to the provider that they may need in order to really work on their health and improve their health outcomes. So one example is one of our partners in Houston, an endocrinologist, sends pre-appointment videos to new patients that he sees with diabetes. And these videos kind of give a little bit of a one-on-one on what it means, what the diagnosis means, what it looks like, what typical treatment and medication is going to look like. And that way, when the patient comes in for their appointment, they have a better understanding of their diagnosis. And they've heard this information from, of course, their trusted provider and not just, scouring resources on the internet. And so they're able to come in prepared with questions. Typically, he sees that this kind of decreases the appointment time, but also kind of makes that appointment time more meaningful and a little bit richer. And so in ways, patients are happier, and also the endocrinologist is able to see more patients in a given day, which of course is huge for increasing access. And then, something we've recently announced is a new integration we have with Cisco WebEx Teams, which allows patients and providers to conduct those virtual visits via a secure video platform that is an easy click to connect. There's no app download. There's no, need to create and remember a password. And the idea that we have introduced is to automatically offer this to patients who cancel their appointment due to some sort of transportation or mobility barrier. So something that's preventing them from physically going into the office. And that's kind of the rules-based structure that we've integrated in order to offer the virtual visit to certain patients. So that's another great way to stay connected with patients and to increase access to patients who otherwise have other challenges and barriers to access. So we know access is important. We know that there are a lot of strategies to increase access, but of course, there's only so much time in the day. There are only so many providers that are stretched thin, possibly already. And so we are also, hand in hand to increasing access and making it simpler for both providers and patients, committed to helping clinics and systems really increase capacity in ways that can help them improve access. So one of the things that we really focus a lot on is helping our partners optimize their schedules. So if your no-show rate is above, let's say about 10%, we think it's time to really fix that. Industry average is pretty high. It's about 18.8%, but we found we can really dramatically decrease that by both cutting no-shows and filling canceled appointment slots. So we call it kind of the reminder waitlist 1-2 punch. So not only are you reminding patients of their appointments to decrease those no-shows, but giving them an opportunity to reschedule if that's what they need to do so that they don't no-show. And then if they end up canceling instead of rescheduling, really filling those empty slots slots with other patients who want that appointment time or want an earlier appointment time. And so this can help fill that schedule and make sure your providers are working at their capacity and your facilities are at capacity, and no revenue is being lost to empty appointment slots. We also are really committed to helping providers save time and money. We think, phone tag is one of the most expensive and headache-inducing things that a lot of clinics and systems are dealing with, along with manual data entry of patient forms, manual reminders, manual outreach. And so we really feel that by doing two things, one, helping automate some communication with patients and streamlining that, as well as offering digital intake forms that integrate with your EHR, we hope to kind of alleviate some of those more tedious and time-consuming tasks that we know can really increase headaches. We also feel like driving more appointments for more revenue is huge. So one of our customers, for example, was able to generate $10,000 in additional monthly revenue by automating their referral outreach. So just by reaching new referred patients and bringing them in for care. And so that's another huge way to help us build a sustainable approach to access. And then finally, we know value-based care is kind of, peeking its head in the door more and more. And so as more payers and more contracts are requiring some sort of piece of reimbursement tied to quality, we know that access to preventive services is huge for driving better outcomes. And so we have a real commitment to helping our partners really succeed under value-based care and driving those quality metrics. So we estimate that by filling gaps in our clinics and system schedules, we can help some of our clinics keep an estimated $120,000 in revenue per provider per year, just by filling those empty gaps. And that's kind of based on that average no-show rate, which we feel like is just way too high. And we know through our experience that we can decrease pretty dramatically. And then one of our partners also saved a ton of time by automating some text messaging communications and reminders to their patients. And so they were spending a lot of time on the phone, just calling patients and obviously being good stewards of health. But by automating some of those processes, they were able to reinvest a lot of staff time into tasks that just were meaningful and more valuable for their patients. So my last slide here is just about our commitment at Luma Health, and then I'll answer any questions you guys have here. We are really committed to partnering with clinics and systems, not just providing a technology service, but to really working together to figure out what the best strategy is that you need to drive more patients to care, how to really modernize communication with your patients, and how to grow your business in a way that's sustainable. And so, we have our certain technology solutions that we'd love to talk to you guys about, but we know that every clinic and system is different. And so our commitment is really to figuring out the unique way to implement technology in your business so that it works for you, it works for your staff, it works for your patients, and it helps you achieve your particular goals. So let's see if we have any questions here. Okay, let's see. I've got a question here about how does Luma Health think about patient access when it comes to community health and helping the most underserved populations get to care? This is a great question, and I think one that's really close to my heart is I feel that Luma Health is, first of all, 100% committed to every single patient having equitable access to care. And so what that means for us is a couple of things. One, we know that text messaging is really widely used among all patients, but in particular, some of the most underserved populations are actually more likely to text than others. And part of that is because they might be more likely to have a cell phone than a computer at home. And they might be working multiple jobs that don't allow them to step away and call in to schedule an appointment or call in to reschedule. So being able to do something quick and easy from their phone via text is really huge. We also offer our product in 17 plus languages. So again, making sure that that outreach is linguistically competent and personalizable, we think is really important for underserved populations. We work with quite a few federally qualified health centers that are doing really amazing work to increase access. And part of that is really reducing those holes in their schedule so that they can see more patients and see them more quickly. We know the demand for good care is there among everyone. And so how can we increase the ability for patients to be seen when they need to be seen and to make it easier for them to do so, given their really unique life situations? How does a patient receive access to schedule their appointment? Great question. So basically, there's a lot of different ways that this can be set up, and it kind of depends on your particular workflows. But if you are reaching out to those new patients, either attributed patients or referred patients via text message, you can always give them a number to call, or if you work with us on online scheduling, you can give them the option to call or schedule online, depending on how you want to do that. We've also seen some interest in using just two-way text message to schedule an appointment between some staff at a clinic or system and the patient. So lots of different ways that that can be sort of set up. Okay. Other things that we've seen in the digital health industry that have increased access to care? I think that's a great question. I think one of the things that's most exciting in digital health right now is just how empowered patients are to really take charge of their own care and to kind of demand the level of convenience and also access to humans, I think, to help them guide them through their care is really incredible. So whether it's some sort of ability to receive health education content online or reminders to take their prescription medication when they need to, tips for managing their chronic care, things like that. All of that is helping patients meet their health goals, and it's also empowering them to be more proactive about those health goals. And so for us, we see that in this kind of increased demand to see providers more quickly when they need to see them. But we also know patients want to see their providers, right? Not just any provider. It's important to have some consistency there. And so we feel really strongly that convenience is critical, as is the ability to maintain sort of that human to human relationship between providers and patients. I think we have time for one more question, and then we'll go ahead and wrap it up. This question is about offering languages that a patient can write a message in Spanish while the provider answers it in English. Does Luma translate? So there is a lot of translation happening within our product. So, and a lot of that is customizable to what your particular workflow is. We can set up different cadences kind of based on what your particular preference is. So I think that question kind of depends on the particular language that you're seeing patients in and how you kind of want to address those questions. So everything is kind of just about anything is possible, and everything is open for discussion. So that's a huge area that we're committed to learning more about and helping our clinics and systems find the best approach. So I kept you guys a little bit over time, but I really appreciate the great questions, and I appreciate all of you who were on for this entire webinar. If you have any questions, my contact information is there. We'd love to chat more about your particular goals and any solutions that we can work with you to implement to best figure out how to increase access and how to do it in a way that makes sense for your practice or clinic. So thank you so much. I hope you all have a great rest of your day and great rest of your week, and I hope to talk soon.